Yes, today we will discuss about the patient safety. WHO, that World Health Organizations, define patient safety as a framework of organized activities that create cultures, processes, procedures, behaviors, technologies, and environment in healthcare that consistently and sustainable lower risk, reduce the occurrence of avoidable harm, and make error less likely and reduce its impact when it does occur. Then we will see that how nurses that engage with patient safety. Nurses are playing important role in ensuring patient safety while providing care to patients. Always nurses are constant present at the bedside. They normally regularly interact with all members of the healthcare team as well as coordinate and communicate of the patient condition to the team as well as the family members. The physician make diagnostic and treatment decisions. When the nurses with positive attitude with patient safety, they reported very fewer patient falls as well as that less medication errors and less special injuries, less healthcare associated infections, and less mortality, less physical strain, and less vascular access device reactions. As well as that patients have higher satisfaction. Actually, that aim of the patient safety is that prevent and reduce risk, errors and harm that occur to patient during provision of health care. In high-income countries, 1 in every 10 patients is harmed while receiving hospital care, nearly 50% them being preventable. Each year, 134 million adverse events occur in hospital in low and middle income countries due to unsafe care, resulting in 2.6 million deaths according to the WHO. WHO that in 2005 they introduced a theme, clean care is a safe care, because then we can reduce that so much of infections by using hand hygiene, hand washing. So it is very cost effective procedure. And 2008 WHO that introduced the theme, safe surgery save lives. If patient has a safe surgery, that means the correct surgery, then the reduced risk associated with surgery. And during the surgery, that we have to maintain the sterility. Then we can reduce the infections. And in 2017, WHO that introduced that theme as medication without harm. Then we will discuss regarding the burden of harm. That first one and the common one is the medication errors. Then the next one is the healthcare associated infections and unsafe surgical care procedures and unsafe injection practices. And the other one is that diagnostic errors and radiation errors as well as sepsis and venous thromboembolism. So what we will now discuss, what are the measures we can get for patient safety. We have to gather all equipment in working order. Before we do some procedure, we have to check all equipment are working. Then we can avoid harm to the patient. So call signal within patient reach. If the patient can easily reach the call signal, then they will call to the staff. As well as we have to arrange the patient room is neat, clean and uncluttered. So then we can arrange that and facilitate patient to be that less harm. And even in the bathroom we have to arrange safety bars as well as the call light. We have to lock the wheel on bed and arrange the good lighting and always side rails up. Other that practices that we have to scrub, then we will be able to prevent infection. Even for the direct and indirect each and every procedure before and after, as well as direct contact of the patient. Another thing is to identify the patient correctly. It is very essential. Use the two measures, two information such as the name and the that birth and or address we can use, especially for medication procedure and as well as the other all procedures. Use medicine safely. We have to label all drugs. Before give the drugs, check that expiry date and the dose. Then the next one is that avoid surgical errors. So that here that correct dose is 12.25, not 12.5 microgram. That's observed. And that is patient safety. Starting a new medication is like starting a new relationship. Don't rush in blindly. So another action is that we can prevent venous thromboembolisms. We have to arrange the patient mobility according to the patient condition and customize hospital discharges. When discharge the patients, we have to introduce them regarding the follow-up care, even for the medication, what they have to take during that hospital discharge, after the hospital discharge, during their home. Use good hospital design principles and assemble better teams and rapid response system. As example, when there is that medication allergy, so we have to respond rapidly, unless we can't save the patient's lives. Shared data to quality improvement. That we have to report some incidents and find out the reasons. Then share with other members. And foster an open communication culture. That means that everybody has to communicate with the other one. That appropriate use of prophylaxis to prevent venous thromboembolism in appropriate patients. And use of perioperative beta blockers in appropriate patients to prevent perioperative mobility and mortality. Use of maximum sterile barriers while placing central intravenous catheters to prevent infections. Not only the intravenous catheters, for each and every sterile procedures, we have to maintain a sterility. Appropriate use of antibiotic prophylaxis in surgical patients to prevent postoperative infections. And asking that patient to recall and restate what they have told during that informed consent process and then verify their understanding. and continuous aspiration of subglottic secretions, then we can prevent ventilator-associated pneumonia. And use of pressure relieving bedding materials, then we will be able to prevent pressure ulcers. Patient self-management for warfarin to achieve appropriate outpatient anticoagulation and prevent complications. An appropriate provision of nutrition with a particular emphasis on early enteral nutrition in critically ill and surgical patients, then we can prevent complication.